everyone, and welcome to the first sofa discussion. My name is Lauren, and I will be your host today. We have some very special guests. We have Andy from Andy's Man's Club. Say hello.
Hello and good afternoon, everybody.
Thank you so much for coming today. We really appreciate it.
Absolute pleasure.
Yeah. And we have Tracy, the outreach manager from Simon on the Streets.
Hello.
Hello. Thank you so much for coming.
My pleasure also.
And we have Lance, our marketing and comms officer from Simon on the Streets.
Hello, good afternoon.
So we're just here today to have a really nice conversation and sort of just see where everyone's at, see what's Andy's Man Club's up to and what Simon on the Street's up to, and just really create that awareness around all of us, really. So shall we get it started? So do you want to tell us a little bit about Andy's Man's Club?
So right back to the beginning.
Yes, please.
Andy's Man Club was formed in July of 2016. It did follow the unfortunate choice of a young man called Andrew Roberts in April of that year, who took his own life.
Mm-hmm.
On the back of that, his brother-in-law, Luke Ambler, wanted to do something, make a difference. Conversations followed between Luke and Elaine, who was Andy's mum, and they sort of thrashed out a few ideas, went back and forth a bit and come up with this Andy's Man Club. It was initially intended just to be a sort of coffee club idea, just a safe space for guys to get together, have a bit of a chat and what have you. Our first ever meeting was held shortly, right at the very beginning of July. I think it was first Monday in July, after Luke had put a post out on his social media, just inviting guys to, if they would be interested in stuff. He got that interest, had our first group, got 9 guys through the door that night, and it's pretty much grown from there. It just expanded. It started out going around Halifax, went out to Hebden Bridge and Bradford and came up at Leeds and stuff. We are now national.
Wow. That is really inspiring. Really inspiring. And Andy's Man's Club is just for men, is that correct?
Yes.
Yes.
Ish. It is a man's club.
Yeah.
But we do have, it is open to anybody that identifies specifically as a man.
Male. Mm-hmm.
A lot of that tends to be male issues that we deal with in the world.
Mm-hmm.
It's around the way that a man sees those issues, the man that deals with those issues. It's men's way of thinking. Everybody in our groups is there for that same purpose, and it's to talk about life and things that go on. So it's kind of shared perspective is why it's a men's group.
Well, that's really good. So just going off the back of that, do you see these transgender men and sort of men who identify men from birth, do they have any issues with them coming, or is it pretty inclusive?
It would be the groups themselves are very accepting.
Accepting.
I do have to be a little careful what I say because all our groups are run on a confidentiality basis.
No, that's fine, yeah.
But we've never had a problem. Let's put it that way.
That's really good to hear. Really nice to hear. Amazing. So, Tracy, please could you tell us a bit about Simon on the Streets, your role, what you do, and things like that?
Hi, I've been working for Simon on the Streets for 9 years this year. Started out as an outreach worker in Bradford. I'm now the outreach manager covering Leeds and Bradford with a team of 6 wonderful outreach workers. So Simon on the Streets, as you may have noticed, it's our 25th anniversary this year. It's first come about with working in Leeds, and there's offices with the Simon community. But what they found was working with homeless people, the hard to reach, the most entrenched rough sleepers weren't coming through the doors. So a couple of guys set up Simon on the Streets, going out purely on an outreach basis, and we've been going ever since. We are only in Leeds and Bradford at this moment in time, and we deal with a whole range of different people. Homelessness is a real big, diverse subject, so it's not just entrenched rough sleepers that we deal with. It's anybody that's presenting with any form of homelessness we will try and help in some shape or form. We are not funded by the council or the government at all. We purely have been surviving on the generosity of the most amazing public, corporate sponsors and bids and grants that we apply for. At this moment in time, we would love to grow and grow and grow, but with obviously the financial constraints, we can't at this moment in time. But the aim is to grow into more areas and have more staff. But yeah, we're not getting any money from any other sources other than the generosity of fundraising and bids and grants at this moment in time.
So, what are the key ways that you support people who are going through homelessness? Obviously, again, that it also includes sofa surfing, people sleeping in the cars and things like that, doesn't it?
Yeah, there's no typical answer to that because our job is so diverse. We
yeah.
never know what we're going to deal with. Each day is so reactive. So it's all about being reactive and person-centred, whatever that person. It could be a phone call, it could be an email, it could be somebody that we've just literally walked around the corner. So we just assess what we're dealing with just in that moment, and all about what that person wants. It might be that they just need directions to get somewhere. They might need to make a phone call. They have no idea what to do. So we just assess it in that moment in time and just deal with it from there. So there's no specific thing that we do. It's just that whatever that person needs, we will try and facilitate whatever we can in that moment in time. So I would say that we specialise in emotional support. There's so many fantastic partners and services out there that has specific roles. Because we can be flexible and adaptable, and because we haven't got any strict targets to adhere to, we can be very, very person-centred and very much about what that person needs. It could be a very long piece of work. I've known people for 9 years coming back and coming forth. And then it might be that we've just had one phone call and we've helped signpost somebody. So it's a very, very varied role.
And it's also very consistent in it, consistently going back to these people, consistently seeing where you can help them. And that's what you and the team do, really, don't you? To help people, just always there on the phone. And it's like, you guys never switch off, do you?
No.
Essentially. Never,
try.
never. No, you try, but
yeah,
just doesn't happen, does it?
We're very emotionally invested. It's somebody's life. It's somebody's son, somebody's daughter, somebody's family member. We might be the only person in their lives at that time. So we want to do the best, what we can. And of course, we can't do everything, but we can help as much as we can, or we can signpost to another service, or, we can just do what we can do, really. But I think it's really important to say that sometimes just a chat, just talking about nothing, just going for a cup of tea, sitting on the floor with somebody, just saying hello, can mean more than actually doing something practical like going to an appointment. Each interaction is always different. Each interaction is always very, very important.
I agree. And I think even with the public or anything else, I think it's still good to smile at anyone and just say hello to things. Somebody could be having a really bad day that day and you've just smiled at them and said hello, and that might automatically make the day, might it? So, yeah.
Yeah, so some of these questions will be directed at you both, so I'll start with you on this one, Andy. So what drew you personally to the work that you're in with Andy's Man Club? Yeah?
Can you pull your mic in now? You sat back as well. Nice one. Cheers, dude.
Cool. No worries. So some of these questions will be directed at you both, and I'll start with you, Andy, on this one. So what drew you personally to the work that you're in with Andy's Man Club?
Long story, I'll try and keep it as brief as possible. All our staff that do my job, we've all started our journey as Andy's Man Club as users, come up and being facilitators and stuff, which we can get into later on. I'm no different in that respect, although my story is slightly different to most of the guys, because I actually first went along to Andy's Man Club to take somebody else. My son, when he was 21 years old, made an attempt on his own life. As his dad, I wanted to be able to help out, try and fix him, whatever, as I perceived it at the time, which lessons have been learned. And in searching for help for him, amongst the many other things, I found Samaritans, obviously Mind, Papyrus, Andy's Man Club came up in that search. Now, obviously, like I said earlier, it all started in Halifax. I actually worked in Halifax in those days, and I found them quite easy, to be honest. I think it was social media, Facebook or something. And I looked into them, did a little bit of research. They seemed to be doing good things. Went home and had a conversation with my son, and he did the typical stubborn man bit and flat out refused to have anything to do with it. It actually took me 8 months of picking my moment, going in with conversations, very careful consideration of what words I was choosing to use to speak to him before I actually managed to get him to a group. And even then, he didn't exactly agree. I kind of didn't give him any more choice in the matter. We went along to Halifax group, and it did what it needed to do for him. I always refer to like Andy's Man Club or Samaritans or whatever as tools, try to do a job. And the time I actually got him there, it turned out it was the right tool for what he needed.
Oh.
You know, it worked for him. He got the benefit out of that. He took the positives out of it eventually, and it got him through that period of his life. You know, he's quite often said that literally saved his life back then.
Wow.
And then he kind of still has. He has quite major OCD issues and struggles around people, especially in groups.
Mm-hmm.
And I think by the time he stopped coming, he'd kind of got through what he needed to go through and was struggling, and he dropped out. And I initially only still kept going because I wanted to get him back. And that didn't happen. And then 7 odd years later, I'm still here. Now, initially, I started to make some mates, shared interests and stuff, and that's how a lot of our groups work, is building communities and social scenes away from the groups and stuff. And a lot of guys connect over things like hobbies and interests, and that were no different for me. He started to get a little bit of feedback that the stuff I was opening up about and talking, other guys were finding beneficial, which seemed a little bit peculiar to me at the time. And then not long after that, I also got invited to join the facilitator team. Now, I still had no clue why it did, but that was quite a personal boost for me back then. And I'm like, yeah, go on, we'll have some of that. Cheers very much. But it also kind of encouraged me to stick around, and I found that me helping other people was actually, I was getting a lot of benefit from.
Yeah.
And primarily, again, lessons can be slow to learn. I have been known to be quite a stubborn individual in the past as well, so some of those lessons take a little even longer. But it turned out that I did actually have issues as well, and primarily amongst them were guilt. It was my son, and I wasn't able to fix him. I'm his dad. I should be able to do that. So by me helping other people out at that group, by being a facilitator, actually I was getting a lot of benefit off, because it helped to offset some of that.
Yeah.
Like I say, it's a long process, and it's certainly not a quick fix. But I got a lot of benefit out from that. I did then. The guy that was running it at the time went on to become an employee of the charity at some point in 2020, and I actually ended up taking over running of that group. That in itself continued up until back end of 2023, which is coming up to 2 years actually now, September, when I also became an employee of Andy's Man Club. I've gone from kind of looking after one group to I'm now known as what's area lead. So I look over, well, at this current moment in time, because I'm covering 2 patches, I've got 38 groups on my patch. My job primarily is to make sure that the guys running those groups are looking after themselves, that they're all right. I also do spend quite a bit of time looking at communities where we can actually get into. Depending when this is coming out, we might have to edit this bit out, but I'm currently in the process of launching a group in Ilkley, which I've been working on for
That's really good.
That has not been announced yet, so if this comes out before
Put it out.
just edit it out. Visual cue there to make it easy. So yeah, I spend quite a bit of time out and about looking for venues and where we can expand, where I've got facilitators that might be travelling to groups that might take us out into their communities for us. And then I spend a lot of time going out to visit businesses. We have a presentation that we deliver to talk to staff and people about what we do, what we offer, and everything like that. So it keeps me busy.
Yeah. Going back to your son, about what you were saying before and how you felt guilty and not being able to help him and things like that, do you also agree that people do also have to help themselves and
Absolutely.
things like that? And obviously on your behalf, do you agree with that as well, Tracy? Yeah.
Definitely.
So, yeah.
It's like I mentioned about tools. Right, and his man club is a tool. It is ultimately it's down to the individual to use that tool,
Absolutely.
no matter what. And one of the things that I was back in those days, I always name drop Papiras because they were quite a big help to me. They are aimed at preventing suicide in young people, but the one thing that they told me, in order to help others, they must be willing to help themselves.
And
Yeah.
you should never feel guilty for that. You've been consistent for 10 months. You've got him into that room, which is a massive achievement as it is.
Lessons.
You should be very proud of yourself where you've got to so far and getting your son where he needs to be, So it is, sometimes you do have to look at the bigger picture, like you guys saying, they do need to help themselves, don't they?
And that's part of why I say it was the right time, because he was ready to accept that help.
Ready to accept it, yeah.
Now, I've had another male within our family that is currently homeless because he has never accepted that he's willing to accept that help.
Yeah.
And I've pulled my hair out and banged my head against a brick wall so many times trying to help him. He's never accepted that.
Yeah.
He has now put himself in a position, not necessarily, a lot of circumstantial stuff and this, that, other, but he's never been willing to accept that help. He has now got to the point where, through his choices and his decisions, he is no longer part of our family. And he is now homeless. He is now on his own through his own actions.
Do we see that a lot, Tracy? Have we had any other examples similar to that?
Or virtually everyone we speak to has no family contact at all. One of the most devastating times that we have contact with family is when somebody's dying or seriously ill. When we do our forms with people, there's not a lot of forms that we do, but one of them is the next of kin. They're saying we don't have anybody because they cut themselves away. They're so ashamed of what they're doing, what's happened. There's a lot of stuff that happens in families that we are unaware of. And a lot of the time they will not talk about family at all. It is too raw. It's too upsetting. They just want to cut and block everything out. So a lot of the time we don't ever ask about family unless they initiate that conversation.
Oh, you need to.
If anybody wants to get in contact with families, we'll always be that bridging gap. And it's heartbreaking.
Yeah.
I'll never forget once we had to literally be detectives and find somebody on Facebook to let them know their son was on a life support machine and it was getting switched off.
Oh.
And when you meet the families and they tell you, well, they did this and they were like this and this, I just don't understand how this has all happened and where they were to where they are. And it's hard. That's the most heartbreaking thing, is when you're dealing with the families. So, we do become very attached to the people that we work with as well, and they become very attached to us as well. So it is hard when somebody's been or going through so much trauma in their lives, that you are that person, that constant one person. But then it's great to see from the other side of it as well, when somebody starts making their own right decisions and starts empowering, and then we can start pulling away, and then sometimes they can fall out with us because they haven't seen us for a while, and then we go, right, okay, that's because you're doing so well. You actually don't need us, but we're always here if you do. We're trying to pull back, but it is a lonely world in homelessness.
And they sort of, you, Sam on the Streets, outreach workers become family to those who are homeless, and also we learn a lot that they make a sort of family on the streets, that's what they get so comfortable out there. So that's what they also do, don't they, is create a family out there. So when they might get put into temporary accommodation or accommodation, they just want to go straight back out onto the streets, don't they?
Unfortunately, the street life, no responsibilities. You've been put in a hostel. You've been living a life where you're on the streets, no rules, no regulations.
Exactly.
You're just fending for yourself.
Yeah.
And then all of a sudden, you've got to be in. You've got to be in at a certain time. You can't smoke. You can't do this. You can't do that. And now I've got to pay a service charge. Well, no, I need that for, if I've got a drug and alcohol issue, then no. So the complexities of putting somebody in a hostel, in accommodation, in their own place, that's where all the real work actually starts, on how to start living again, basically, because you've been out on the streets with no rules. The only rules are survive. Survive that hour, survive that minute, survive the day, survive the night. You know, so much trauma can happen out on the streets.
Yeah.
So, you know, a lot of people don't understand, well, you know, they've got a house. Why don't they just stay in it? Because as soon
It's
as
not
you close
simple,
that door, then you've got that quiet. And then that's when your mind, that's when everything starts coming to the forefront, what you've got to deal with. And it's too much, just too much. It's easier sometimes just to leave that door and go out on the streets.
It's just not as simple as people think, do they? It really isn't.
And it can be heartbreaking to see
Yeah.
because as a worker, all you want to do is get them off the streets and somewhere nice, or get them to rehab, get them to the recovery. And part of recovery is relapsing. And I'll never forget the first time somebody relapsed and I blamed myself. And I was chasing them down the street saying, please, please, please come back. And they just wouldn't. And at the end of the day, as Andy said, it's that person's journey.
Yeah.
It's that person's life. No matter what we can say, what we can do, how we can, you know, guide them and show them, and that is that person's life. We can't stop anybody doing what they're doing.
No.
You know, we can always be there to pick the pieces back up. Okay, right. What did we learn from that? Can we learn from that? Can we move forward? Can we start again?
Yeah.
And if they don't start again, right, that's fine. How can we be a support to you in just whatever shape or form?
It's always 2 steps forward, 10 steps backwards,
Yeah.
isn't it? It always seems to be the case.
It's taking the rough with the smooth, and it is trying to find the positives, especially when somebody has relapsed. That is, it's hard when somebody was doing so well and they're back out on the streets again. Sometimes worse off than what they were before they even went in. But it's a journey.
It is a journey.
It's their journey. It's not our journey. And my job is, because I've done this for 9 years, for my team, is to say, I need to protect them, because it's so difficult when you see somebody relapsing or lose their accommodation.
Absolutely.
And, you know, they're doing so well and then something happens, and it's devastating because we want it so much for somebody.
Yeah.
You know, but at the end of the day, it's their life.
It
And
is.
whatever they choose to do, we have to honour that.
And support that,
Yeah.
no matter what, isn't it?
Yeah.
And there's no judging or anything like that. So one of our, obviously we're passionate, non-judgmental, empathetic, and we really do follow that. I would say since I've started this job, we are non-judgmental. Everyone is so lovely. You can say what you want to the team, to anyone, and we'll just support you with whatever you want to do.
I think that runs through both organisations, the
Absolutely,
non-judgmental aspects of it,
Yeah.
and that's why it works so much.
We remind the guys at the beginning of all the groups, we offer a confidential space so that they can talk about what they need to get out and not have to worry about that creeping out into their daily lives. They might be talking about stuff that around that. We are also non-judgmental.
Yeah,
You
it's
know,
so key to be though.
Life is full of ups and downs, and it can throw all sorts of things at you. And we don't measure those problems either. You know, what can seem a little trivial thing to a person might actually be having massive detrimental effects, and I'm sure you guys will have similar experiences. And some guys come in and it kind of flip that on its head. It can actually work, especially when you get the newer guys coming along, and they might not be willing to join in. They're just coming along to see what it's all about at first. And as we have a ball, what we pass around as we're asking the questions, and as that's going round and they do hear people talking about stuff, that then enables them to be able to share theirs, because they say, well, if he's talking about that, I can talk about what I've got. You know what I mean? And that's powerful in itself. But yeah, it is very much non-judgmental. I mean, we do have a couple of rules. We don't talk about criminal matters.
No.
You know, a person's past is their past.
Yeah.
If they're on that track where they are wanting to open themselves, we're going to have the back.
Yeah.
You know what I mean? We don't talk about medication.
No.
Nobody at our groups is there in a medical capacity.
Yeah.
Everybody in our groups is there as their own person for their own reasons. So nobody's qualified for that stuff as far as we're concerned. And then politics and religion, because they're just divisive.
Yeah.
We're not going to go there.
No.
It's not happening.
Yeah.
You know
It
what I mean?
starts off. Yeah. It
And
just starts a bad argument.
that is the 4 rules that we have. That's it.
Yeah.
They've all come about through lessons that have been learned in the past.
Yeah. I can imagine.
The 3 of them, I was in the group where it happened, or certainly within the venue. The medication one especially, and we know that they're all right with us talking about. I'm not going to go into specifics.
Yeah.
But there was a guy in the group, and I was actually sat in it, who'd actually come off his medication the week before. Felt fantastic. Great. Yeah, no problem with that. But he recommended it. And another lad that was
Right.
sat in that group took that advice, took it home, went home and stopped his medication, and ended up in hospital for 8 months.
Right.
I'm with you. Oh God,
And it
that's
were-
really bad.
His dad reached out to Luke directly and said, please, can you do something about this?
Yeah,
So that were it, that rule were born. We do not discuss medication.
I think that's a very valid
No.
rule
Yeah.
to add.
They can talk around it. So if a guy has come off, you see, I've recently come off my medication and I feel great, that's fine, because it's his feelings and his experience. Any more than that, we draw the line.
Yeah, that's
Best to just keep it to moral support, I guess, and
yeah.
it keeps it uncomplicated as well, which
And
I think
it-
it has to be.
Big part of what we do is to enable guys to talk and to get used to the process of opening up and talking about things. And like I said before, that is a process.
It is,
You know,
yeah.
people aren't going to come to us straight away and start blurting out all the deepest, darkest troubles.
Yeah.
But over time and getting into it and following the process, a lot of that stuff can come out in end.
And everyone's journey is different.
Absolutely,
You
yeah.
can't compare your journey. So if, for example, that gentleman's come off his medication, he felt amazing. But, you know, like I said, everyone feels different in certain, like, you know, it could take him months
But as
before he
long as
feels
he's
right
done
before he
that
comes off that.
under his medical supervision, because only his medical people know his history.
Yes.
And at the time he's right, and depending on what medication we were on, you know what I mean? So it is all personal.
It is personal.
I talk a lot about, as people, we all go through stuff, right?
Absolutely.
Yeah.
Life has a habit of doing that. There's no getting away from it.
Yeah.
Some of that stuff can affect different people different ways.
Absolutely.
And the circumstances around situations that happen will always be unique to individuals. A lot of what we do is sharing potentially similar situations. So it's like, and again, I'm sure you mentioned yourself about substance abuse or drinking or whatever. Certainly when it comes to guys, a lot of guys will use that stuff to self-medicate because of mental health
Yeah.
issues, reasons, whatever. Where that can then take over and become problematic and can lead to things like homelessness in itself.
Of course, yeah.
When that process comes round, once they've started to get, maybe they've gone through you guys, starting to get into that better place, maybe they're then ready to come to us and continue that journey. Start talking about some of the issues that led them to that in the first place. Sharing those experiences with other guys that might have gone through similar types of situations and how they've got through it, seeing how other guys have got through it, they can take inspiration from that. It's like, if he can do it, it might be a chance for me.
Absolutely.
And then maybe even utilise shared information. Maybe somebody is currently homeless, talks to another guy in that group that has been through there, might have experience using you guys, and you can say to him, well, go check out Simon on the Streets. They were really good for me.
Yeah.
And he may or may not run with that. He may or may not choose to take that opportunity,
No,
but that's his choice.
it is his choice.
But he's sharing experience about similar experiences, and that's exactly how we work.
Yeah. Sometimes when you've got a problem in your own head, you're isolated in that thought, are you? Sometimes not even sure if anyone else has had that experience or whatever. So
Absolutely.
it's vital to open
And
up
I
and talk.
kind of, I think I said to you, Wayne, didn't I, that, and it's not uniquely, but it does tend to be a bit more of a blokey type trait, is that we can be really good at internalising stuff.
Yeah, 100%.
And when we're faced with a challenge in life,
Yeah,
it's, why me?
yeah,
Why am I going through this?
yeah.
Sit in our groups, hear about guys talking to stuff, that realisation that actually it's not just me, is it?
Yeah. Men really don't
Life
talk
happens.
about the feelings.
No, they
at
don't.
all.
It's still a thing. In,
It's
like me and
still
my
a thing,
mates
yeah.
talk about it in the pub. We're always like, "Oh, do talk if you need to or whatever," and then we just never
You
do.
don't.
It just goes to football or
No.
just
Yeah.
usual topics, So it's
And-
like it's still the stigma's still there.
A big reason that I've personally experienced when talking to, I've spoken to many, many guys over the years, and a lot of that, and we'd be stupid ourselves for doing it, stubborn, whatever you want to call us, is burden. We don't want to burden people that we care about, whether that is family or friends, with our troubles, because we don't want them worrying about us. And we're also still belligerently stuck in the idea that we should be able to handle it.
Yeah.
And I'm going to say I do think it is to ego as well, isn't it? Because it,
Big part of it.
it's sort of like men of the hierarchy. Like we should be one protecting everyone else, and they shouldn't have to sort of go through anything that I'm going through.
Yeah.
And a lot of men do just cover it for ages and ages, and then all of a sudden you'll find out, like say for example, someone in your family's got something going on, and they'll just cover it for ages until it finally comes out, until they need that help.
We call it wearing the mask.
Yes.
You know, you put your mask on,
absolutely.
you put your brave face on, you pull your big boy pants up, you go out and do
Yeah.
what you need to do. You get your head down, you crack on with it, and you man up.
Mm-hmm.
Massively detrimental 2 words, that man up, as far as we're concerned.
It's
I mean, there is another
horrible.
group out there that are using it and try to turn that into a positive, and fair play to them.
Mm.
Absolutely.
Mm-hmm.
I see what they're trying to do, and
Yeah.
I'm not going to slate that in any way, shape, or form. But as men, that's what we do.
Yeah.
A lot of it is upbringing. It's
It is.
history, whatever you want to call it.
Mm-hmm.
And a lot of it is ourselves. You know, I'm going to say it many, many, many times as we go through this. We are stubborn,
Yeah.
and we do still see ourselves as. And even in this modern world, it's kind of stupid, but we do see ourselves as the provider, the one that should be looking after everybody. And we put that on ourselves as much as anybody else does, you know.
Yeah.
And we put that mask on and we get out there and we crack on with it.
Generational pressure in it, and I do think it's going to take another couple of generations to
Oh,
get
yeah.
further away from it. Is even this itself is a slow process, like changing the narrative, isn't it? So that's probably. I do think Andy's Man Club will probably be around for a long time because it's going to be needed for a long time, forthcoming as well.
It's also a kind of side effect of what we do, because the guys come to the groups, they sit there and chat week in, week out. But a lot of them will then take that away from the groups and take it home with them. That's where we can get to the next generations. We don't deal with under 18s. There's a lot of safeguarding stuff goes on.
Yeah,
what
and
have
it
you,
becomes complicated.
we're
doesn't
just
it?
not in a position where we're yet able to do that.
Mm-hmm.
I'm going to say never. I might get shouted at that when I get back to office, but I'm going to say never. But at this moment in time, we're not in a position to be able to.
Yeah.
And we do know that what we do well, so we have to kind of keep our focus on that.
Mm-hmm.
But like I say, a lot of the guys, they do learn to open up and do learn the benefits, and then do take that ethos back home with them. And you might meet guys week in, week out and say, you know, I can now actually talk to my missus
Yeah.
because I've learned to be
yeah.
able to open up. And then kids get the benefit out of that.
Absolutely.
Kids hear the dad, you know, our T-shirts and stuff. You go to events and you see kids as facilitators or whatever walking around in Andy's Man Club T-shirts or with wristbands because they know that the daddy goes
Yeah.
and what he's done for
Exactly.
him.
Yeah.
So next generations
I
is
think
a
the
big
next
part of it.
generation, you know, with what's going on, and the media's been quite portraying of the misogyny, the Andrew Tates of the world, and what they're doing in social media and all that's coming up. You know, it's being highlighted, isn't it?
Mm-hmm.
More and more. You know, there's great things going out there to highlight these issues, and it needs to be stopped. You know, this does need to stop. We need to talk. We need to look after each other.
Absolutely.
We need to be kind. You know, the people that, you know, who are out there on the streets, they go through so much trauma. They've been through so much trauma, and it's like, where's people's kindness? Where's people's empathy? You know, everyone's got a life. Everyone's, you know, human being. What that person is going through might not be any more or less than what you're going through at the end of the day. But men, we find with guys, you know, we become a bit of a mum figure. And because with the confidentiality as well, a lot of the work that we do, so say if we've got somebody sat in the car, the most powerful experiences I've ever had is sat in a car with somebody and they've told me their trauma of what's actually happened to them. They've never told anyone before, ever. And it's just a very closed, safe place, and they don't have to look at you.
Yeah, that's so
and
true.
that's been the most powerful thing for me, that I found that they've had the strength and the courage to actually tell you what's, you know, a lot of people want to validate why they're the reason why they are as well. And it's like, you don't need to.
No, you don't.
You know, life is hard, and predominantly everyone has gone through something horrific in their life that nobody wakes up to say, I want to sleep on the streets. I want to be a drug addict. I want to be drinking all day long. You know, nobody wakes up to do it. That is not anyone's goal, ambition. It's a sequence of events, a sequence of life events. And with this, not talking to somebody, not having somebody you can share that with, the more that we can open up, the more that we can share our experiences with places like Andy Man's Club. It's just so needed, especially for men's mental health.
And I think, do you find that people are quite opinionated on homelessness and things around that? And obviously that is without knowing someone's story as well.
Yeah.
Like you're saying,
Be
that everyone
very
has a story.
judgmental.
Yeah.
You know, and it's yeah, they might be doing something wrong in society at that moment
yeah.
in time, but there's a reason why. You know, not
Absolutely.
everybody is born, you know, and they're going to end up in criminal justice system.
No.
For it, there's a reason why to what's happened.
Always a reason. And I think that's what people really need to realise, is that there is a story, there is a reason. They've not done this on purpose. They don't want to be there, but that's where they found themselves to be, isn't it?
Yeah.
Mm-hmm. So, again, a question for both of you. We'll start off with you. Do you see a sort of increase in a demand in Andy's Man Club throughout the years from 2015? Do you see it increasing or?
Like I saying, when we started off with that one group,
Yeah.
rapidly approaching 9 years ago,
Mm-hmm.
9 guys that first night,
Mm-hmm.
we have just launched, it's not actually open yet, it's opening next month, but we have just launched our group number 300.
300.
300 nationally
Wow.
around the UK, England, Scotland and Wales.
I didn't know it was 300. Wow, that is
That's impressive.
that is very
And we
impressive.
get nearly 6,000 men attending every week.
Wow. That is amazing.
Speak for yourself.
Yeah.
Yeah.
Yeah. Numbers say it all, don't they?
Yeah.
Yeah. Now, I mentioned earlier the confidentiality, so we don't keep any registers of who they are, demographics, anything like that.
Mm-hmm.
And the reason we do actually keep a head count every week. So, like I mentioned on the clubs I'm looking at, part of that, I get a head count reported back to me, and within that there's a breakdown of how many new guys are coming each week.
Mm-hmm.
Because some guys might come along just for 1 week, and either it don't fit, it's not the right tool for them. Coming along sometimes once is enough. Knowing that there are guys out there talking can be absolutely enough for some people.
Mm-hmm.
Some guys will come and keep coming and keep coming and keep coming. But we do keep a part of that count is how many new guys are coming, so we can monitor how the clubs are doing, what sort of reach they're getting, how we're actually reaching new people and stuff, and still doing what our aims are.
Mm-hmm.
We are massively fond of hashtags. And one of our key ones is that one man, and that is our core ethos, is to reach just that one man.
And what does that
Get
mean
him
for
in.
people who don't know?
It's basically anybody out there, everybody out there potentially is going through a challenge in their life.
Mm-hmm.
If we can reach just one, we've done our job. And then we get the next one and the next one. That's what we are there for. Pretty much everything we do, our core, everything. Now, it's a funny one because it's called Andy's Man Club, and it is about helping men. But the purpose behind it is actually the families.
Families.
It's to stop the families having to go through what Andy's family went through.
Yeah.
I'm with you.
So it is reaching, but if we can reach their man, whether it is the dad, the son, the brother, the cousin, the nephew, their uncle, if we can reach their man and help him, maybe stop him getting to that point where he makes the choice that can't be unchosen, we've done our job.
Very good. And what about you, Tracy?
Same
Do you
for us, yeah.
do you see an increase?
Yeah. Since the 9 years I've been here, the whole demographics of homelessness have changed. You know, when I first started, we were primarily known as working with the entrenched, hard to reach, rough sleepers. Now it's anyone. We get phone calls, we get emails from families, from just anybody, people working, you know, all the changes in with rent, with the mortgages, you know, the housing crisis, the cost of living crisis, COVID, you know, all these factors build into homelessness. It's not just your rough sleeper that you can visibly see. There's all your hidden homelessness. There's all women that are the whole way rough sleepers are counted throughout the country. Women aren't a big part of that. Women are more hidden. So we've been part of a 3-year census, which we work with partners across Leeds to gather data, to then lobby government to say, look, this is a much bigger problem than just seeing a visible woman sleeping on the streets. So we get together with partners. We know who's vulnerably housed, who might be walking around all night, who's not actually sleeping on the floor when, you know, we do a count. an official government count. So there's a lot of hidden homelessness. There's a lot of sofa surfing. There's a lot of family breakdowns where they've kicked their son or the daughter out, or the husband or the wife out. Where do they go? They go to the council. People think they're going to get housed. Where they're going to house them? There's no correct housing for that person. You're not always going to get housed. There's no stock. There's a whole many contributory factors. So the change from where we work, what we primarily worked with, the people that did not engage with services, we now work with anybody, and that's the difference. We can't help everybody. We're too small. We just can't.
No.
But if we can take a phone call or a quick email and help and signpost, put them in touch with the right services, or at least we've helped them in some shape or form. But yeah, it has really, really changed.
And how many people are on your team in
4.
total?
4 in Leeds and 2 in Bradford. I could double that tomorrow, but
Yeah.
because we haven't got the funding
No.
for more, we need more workers.
And this
Our
team,
caseloads are massive.
yeah, and they do so much, don't they? And have so many people that they help on a daily basis. Obviously, you as well, but
Yeah.
you are very stretched
Yeah.
in what you do.
Yeah,
Mm.
really stretched. We would love to take on more workers, and we're going down the volunteer route now, which is will start to help with the workload.
Mhm.
But it's sadly we're not going away.
Nope.
Thinking out loud, quick question, if I may.
Go on.
You mentioned there, and it's funny things that pop up because people talk about homeless, and you immediately are drawn to thinking about guys.
Mm-hmm.
Are there numbers and statistics out there about percentage of male to female with homelessness?
There is, yeah, but I'm not going to reel them off the top of my head.
Fair enough.
We've
shut
just
up.
been part of a women's conference yesterday, which I'm very proud to speak about. That it is women just on the data is not representing
Right.
what's happening with women. So for the past 3 years, all over the country, there's been organisations doing a census once a year and submitting this data to the government to make changes. And this is what needs to be done, because services are only being invested in because it's a male, the data is getting reported for, not females.
It's right, because we talk quite a lot about statistics and things, especially around suicide. And certainly UK figures, 75% of all suicides are actually male.
Yeah.
Wow.
It's the latest numbers that certainly I have access to and work from is there's nearly 5,000 men every year in the UK that take their own lives, get to that point.
Oh.
And it's interesting, like I say, talking about the kind of hidden female side of homelessness. It just sort of made me think, I wonder if there was sort of much correlation
Well,
within a lot of that,
It's being morbid, but the grim reality of it is that the average age of a female to die who's homeless is between 41 and 43. And these statistics are horrific. With a male, you're looking at around 45, the age is 45. So that's so young.
Very young.
We can link in other different statistics across the cities, but what hit me hard yesterday was around 26 women died last year in Leeds who, shouldn't have died.
Absolutely horrific.
It is at such a young age. And when we look at people's backgrounds, a lot of people have come from care.
Yeah.
It's all childhood traumas. All the preventative work that could have happened when, there were children, growing up, people to talk to, people to help, people to guide them. Abuse is massive in the people that we work with, neglect, abuse, childhood sexual abuse. This is the main contributory factors that lead to somebody's short life.
Mm.
And, you know, you add drugs, alcohol, mental health into that mix as well.
It's exactly
Your
like I was
life
saying earlier, innit?
expectancy.
Turn to substances to
To
mask.
block it out,
Yeah.
completely. To completely and utterly block something out. And there's that many barriers and boundaries for people to try and get their life back on track. You've got to be here at a certain point, but how can you be there at a certain point when you don't have a watch, you don't have a phone, you don't even know where to go to. You've got to go to, say, if you've come out of prison and you've got to go to pick up a script for your medication. You've got to go to housing. You've got to go to probation. If you don't go to probation, you're going to get recalled. If you don't go to housing, then you're on streets, and then you might bump into somebody. You want to see your family. There's a whole different array of factors. There's so much red tape, so many barriers, and even us as workers to plough through all that. It's so difficult for us to do that, never alone somebody who is just coming out of prison, just coming out of hospital, just trying to navigate a pathway. The pathways are so hard to actually get your life back on track. It's quite easy just to walk down the street, go get some drugs, block it out. There you go. Done. Because it's so hard for somebody who wants to maybe change their lives. They may have done a stint in prison. They want to get back on track. But from them coming out, those pathways aren't formed. And you're going down that road. And there's that much to stop you turning your life around. It's very difficult. So for us, we like to do prison pickups. We like to go to hospital with somebody, stay in contact with the ward. When are they getting discharged? What's happening? We'll go pick them up. We'll do this. Try and do that bit of hand-holding to navigate through those pathways as much as we can to try and alleviate some of that stress for the people that we work with.
Yeah, so we've answered some of the questions already because we've been freely discussing things, which is really good. But can you both share a story, obviously, while preserving any anonymity that stayed with you today?
Yeah, I mean, we've got lots of stories. It's really hard to choose one, but with there being so much doom and gloom out there, I want to give a positive. Do you know what I mean? Because what we deal with is so traumatic, and we deal with a lot of bad stuff going every day. When you're working with somebody, what we want for somebody doesn't always work out. But 6 years ago, there was a lady that we'd tried to help. She was already housed, but in a really, really bad way. Serious mental health. We actually thought that she was non-verbal at the time, and just really difficult to communicate with and try and help. But eventually she was in Leeds. We've worked with her. The familiarity of Simon on the Streets from Bradford to Leeds helped. And over a period of 6 years, we have gone from not communicating with anybody, not working with anybody, living on the streets, just really, really hard person to work with, to now has received the best medical interventions through. It wasn't easy. It was like in hospital, out of hospital. I remember one of the workers would take her out on day release. She'd run off, then getting back. And it was that constant keeping in touch, keeping it going, fighting for her rights, fighting for everything she deserved, not getting the right treatment, advocating for that, just literally fighting the system all the way, to eventually now in their own accommodation, doing things independently. Yes, we still see, but that is just for that emotional support now, to then going on to looking at further education, to now even talking about signing up with agencies.
Wow.
To completely and utterly turning their lives around and being independent. but still like having our little bit of an input. But it's now just going for a coffee or let's go to a charity shop, something like that. So for us, that journey, it's still ongoing. You know, there's still that support element there, but it's teetering off. But that's an example of a period of 6 years. Now, we don't all have all those success stories, and there is a lot of people that don't make it, and we have had a lot of deaths at Simon on the Streets, and it's been very traumatic for the team. Only a couple of weeks ago, we had 3 funerals that we attended, and that was horrific. So we don't have all the nice, happy endings as in this one, but we have put, you know, a film together called Amy's Story. Obviously, that's not their name. And when we see that film, it brings to light the work of what we do and why we do it. You know, everybody's journey, it's a long journey. And we can help in some shape or form reshaping their lives. And that is what it's all about for us to, you know, go away and went, yeah, we've done a good job there. We've done as much as we can, and we've done a really good job. And that's means more to me than anything else, really. About the dedication of my team and the dedication of Simon on the Streets, getting the best for that person. That's what we'll always strive for.
That's what it's all about. That's the whole
is,
reason
yeah.
why you do it.
Yeah.
Same to you, Andy. Do you have a story that's stayed with you? I know you gave us
In
a
a word,
really
no.
good story earlier, but
Like I said earlier, the confidentiality thing is a massive part.
yeah,
And everybody's story is their own, so it's not mine to share.
yeah,
But I'm going to kind of flip it around a little bit and change the question to
Yeah.
fit. And the answer I'm going to give is the entire thing, the entire Andy's Man Club. Like I say, starting out with that one group, growing to where it's got to today, as I mentioned earlier. All our groups, like I say, are run by volunteers. If you can bring volunteers on board, there's some really, really good people out there. They've all started their journey as a user. They've got to that better place, want to give back because they know what it can do. We do also invest a lot of time in making sure, like I said, the main reason my job exists is to make sure them guys are looking after themselves, being able to switch off, take that stuff home, whether you call it me time or whatever. I would hope, massively hope, everything you've said today, that you do something for you, because it is the other main piece of advice that I got, which is kind of appropriate, I think, to start to wrap things up. In order to look after others, first you must look after yourselves.
Absolutely.
Yeah,
agree with
that's been
that.
a long process
you're-
through these 9 years I've worked at Simon on the
Yeah.
Streets.
If you're
Like,
burnt out
yeah.
and a shell of yourself, you can't help anybody else
My
get out of
saying
there.
used to be, I'm not burnt out, I'm cinders.
There you go. There you go.
So that's why I come into being an outreach manager kicking and screaming, because I never wanted to do that. But what I get out of that is, through what I've been through, I don't want my team to go through that. And also, I'm not like that anymore at all. You know, I do put things in place because we've got such a good support network here at Simon on the Streets. We all support each other, whether it's
100%.
fundraising, our CEO,
Absolutely.
all the team. We are all very, very supportive. But not only that, we've also got other really good partners as well that look out for each other, and we can see the signs in other workers when they're burnt out as well.
Yeah.
We can say, whoa, yeah, that was me. You know, you can recognise the signs. So it is very much, you can't put the work in. You're so right. You can't put the work in if you're not right. And if you're going through trials and tribulations at home and stuff's going on in your own personal life, because nobody has a perfect life, you know, this type of work can take its toll on you.
Massively.
It really can. So with the support of your work colleagues, your work family, and what you have to put in as well, you can't give that to somebody else if you're not right. So it's, you know, the vicarious trauma that, you know, the stuff that you hear, the stuff that we hear, you know, it's horrific, you know, what somebody's gone through, and you absorb all that. So what do you do with that? You've got to look after yourself. You've got to have an outlet of getting that out as well, and looking after yourself. Otherwise, you just can't do this job.
And I think that's so key for people to make sure they are open with colleagues and things like, because you come to work one day and you're not your usual self. People think it's them that you're being off with and things like that. But if you're open and honest with your colleagues and things, it makes a real difference. And then, you know, we are like a bit of a family here, aren't we? We are very open and honest with each other and how we
It's
feel.
spotting
and
the
things.
signs, because I know the signs when,
Yes.
you know, a client, you know, might have not turned up and like you're getting a bit annoyed or a bit frustrated about it, and that's because you're starting to burn out. We need to pull that back now. Like, no, go and take some time out. You're not seeing that person now for a little bit of time.
And you're
let's
really
pull
good
back.
at recognising that as well.
I
with
am,
your
because
staff.
I've been through it all myself.
Yes,
you know,
yes.
I was the worst person for it. So now when I'm saying to my staff, "You finish now. You need to finish. Go home."
Yeah.
No, go home. I was the worst one for it.
Yeah.
But I know what impact that can have on you, and we have to really look after our staff and look after ourselves.
Absolutely.
That's a really good note to end on.
Yeah.
Good saying.
Thought it might be.
Yeah. Right then, that's everything. So
Yeah,
thanks
thank
very
you.
much for your
Yeah.
time.
Absolute
Honestly,
pleasure.
both
Really nice chat.
very inspiring people. Hope people feel as inspired as I do, for sure. But thank you so much for both coming and doing this.
Thank you.
Thank you.
Thank you.
Thank you.
Spot on. Job done.
That's a wrap.